Okay, let's get this started. Narcissist versus borderline personality disorders. Remember, disorder is what you got. Personality disorder is what you are. That's my opinion of it. But after 17 years of being a psychiatric nurse, I never heard one on a unit. I never been in a nurse's station. Nobody talked about having a narcissist on a unit. I never heard a doctor talk about it. Never heard a psychiatrist talk about it. Never been in a meeting talking about a narcissist. Nothing. Zero. Now, I know they're out there because the DSM-5 said it's a real thing. Carl Jung, my hero, said it's a real thing. But sort of like finding a leprechaun. They're real, but can't find them. So I want to talk about the narcissist versus the borderline, because borderlines, met a lot of those. Had a lot of meetings about those. Had doctors talking about those. Had nurses talking about those. I got a report on many of those. So if a person came to me and said, hey, Steve, you can take the narcissist or you take the borderline. I'll take the narcissist because never seen now. Now, social media, they got licensed clinical so-called doctors talking about it. They can know the behaviors, the experts in the characteristics of that particular personality disorder. But yet, I don't think they're the most dangerous. Because to me, the way social media and the expert says, they just tall, good-looking, Dracula-looking dude or chick. They're to drain the life out of you. But have you ever asked, what if they ugly? Can they get close enough to you? Take advantage of you? What if they morbid obese? What if they like a shark king? Can they really get close to you? What if they dumb? Can a narcissist have a low IQ? So it's a lot of factors come in just the human, makeup. Now, borderlines, I already know they're gonna love me or hate me. Most likely they may hate me. But if they love me, they're gonna hate the others. Those are real personalities, disorders that runs through the mental hospitals by volumes, affecting other people's lives, other people's relationships. It's something that I gave meds to a patient for, and I never gave medication for somebody being a narcissist. Right? I'm not saying they're not real. I'm just saying I don't think they're dangerous. I never met one. They're like a leprechaun. The people in social media, they lying to you again. It's a big lie. They probably just spoiled brats. So if they tall and beautiful, maybe they just spoiled brat because everybody kissing their butt. Maybe there's some rich kid spoiled. Like my kids are spoiled. What I'm trying to say, new nurses, stop worrying about stuff that you can't see. Okay, it's a book named 1884. I was going to quote it, but I'm going to summarize it. Basically, in the passage it says, believe your own eyes and ears. Because people tell you that war is peace. And peace is war. When you have peace, you think there's a war going on because they have to manufacture war. Then they want to prove to you that this war is okay because it's for peace. It's to make the world peaceful. Believe your own eyes and ears. Personally, I never seen one, never talked to one. If I did talk to one, they were nice to me. So if they were nice to me, I'm okay with the narcissist. But put in the comments. If you think I'm lying, put in the comments. I challenge anybody, because I'm tired of hearing about it, because I was in an Uber going to work because I had my scrubs on. I was going to the mental hospital. This young lady started talking about her boyfriend, ex-boyfriend, is a narcissist. She just come throwing all these jobs at me. But since I wasn't getting paid for that, I didn't say nothing. I didn't respond because I'm not a doctor. I don't do diags. I don't diagnose people. I just follow the orders of the doctor. And like always, this is for entertainment purposes only, educational purposes only. I'm not your nurse. I'm just a nurse with a lot of experience, I'll take the narcissist any day of the week over borderline personality. That's just me. Now, side note, a psychopath, those are real. Sociopaths, those are reals. I met them, talked to them. Now, there's some real stuff you need to be worried about out. But little spoiled brat, so-called, you're a narcissist because you're an asshole. Damn, I cussed on the video. You don't need to worry about that, especially if you're a nurse. Till the next video, I'll take the borderline. No. I'll take the narcissist every day of the week. Deuces, we out of here.